Good afternoon, everybody. I'm Sanyukta from Vistas Media, your host for today on Here All Issues Are Resolved YouTube channel. We go through a lot of look beautiful related issues as we grow up, but little do we realize that it's our hair that's our crowning glory. Our hair symbolizes health and personality. Gorgeous and healthy hair is an instant confidence boost. To guide us on how to take care of our crowning glory, that is our hair, we have with us an expert dermatologist. Dr. Sujay M is a dermatologist and empathetic clinician from Bangalore. Dr. Sujay is a dermatologist. She provides treatment for conditions related to dermabrasion, acne treatment, wart removal, laser hair removal, photofacial, skincare, anti-aging treatments, botox fillers, derma roller, etc., etc. She is also a member of Indian Association of Dermatologists, Venereologists and Leprologists, IADVL. Bangalore Dermatological Society, Bangalore Dermatological Society, and American Academy of Dermatology, AAD. Dr. Sujay has attended many conferences and seminars where she updates her knowledge about the latest advancements in the field of dermatology. She also has derma laser facilities at Medicare Skin and Cosmetic Clinic, JP Nagar, Bangalore. A very warm welcome to you, Doctor.
Thank you, Samita. Thank you for the kind introduction.
Doctor, as today we are going to talk about hair management, and we all know that hair can make or break our look. Now, the thing is that we do shed a lot of hairs on a regular basis. A lot, maybe 2 to 4 to 10 to 100. Now, my question is, how much hair shedding is considered normal?
Every day is considered as normal. So when I say some amount, it means it averages between 50 to 100. So usually the human hair follicles have an independent hair cycle. So the hairs which are in the anagen phase, they go into the catagen and then to the telogen phase. And this happens individually for each hair follicle. So that's the reason we don't shed all the hairs at the time.
Mhm.
Okay, so at any point of time, so we have around 80 to 90% of the follicles which are in the anagen phase. So the hairs which are covering our scalp. Okay, maybe 10 or 20% they are the follicles which are going into the telogen phase or the resting phase, where the hair root it becomes miniaturized and then it sheds off. And on an average, the human scalp has around 1 lakh hair follicles on the scalp.
Okay.
And in this, yeah, maybe 50 to 100 strands falling per day is quite normal. And usually these anagen phase hairs, they stay on the scalp for about 3 to 7 years before they fall off. Okay, so and this is about the normal hair cycle and the number of hairs falling every day.
Right.
Okay, and so you should be concerned when actually you see the number of hairs falling is more. Hair all over the house, on the bed, on the pillow, and in the sink. So this is the time where you have to be concerned about hair fall. And also at times you may not notice an increased hair fall, but there could be thinning of the scalp.
Right.
Okay, maybe the number of hairs falling per day might be less, but still the scalp might be thinning gradually. So even in such conditions, you have to be concerned and you need to take a dermatologist consultation and evaluate for the cause of hair fall and get it treated accordingly.
Right. So that's when we should be concerned and go and consult a dermatologist. Now, the question is, whenever, anything wrong happens with our scalp or skin, we have a tendency of quick fixing it with some home remedies, or we go to the over the counter, medication, or start using products which claims that they'll make less hair fall. Now, my question is, many a times, because we waste a lot of time, energy, money in these home remedies or OTT products, etc., because market again these days are flooded with products. Now, is it a okay thing or normal thing to try home remedies or other things before going to a doctor, or this may actually worsen the situation?
At times, when the hair fall increases, it is very important to evaluate why the hair fall is happening first.
Right.
So there might be an internal cause for hair fall, and you're doing home remedies, you're applying the serums available in the market, you're taking the supplements, doesn't reduce. So in such cases, we have to evaluate the exact cause of hair fall and treat accordingly. So it is better to consult a dermatologist rather than wasting time on other home remedies or other applications which are available in the market. So first try to find out what exactly is the cause of your hair fall, and then it's better to treat it.
Right. So diagnosing the cause is the most important thing, and only a dermat can do that. So in case we are seeing, abnormal hair fall, or more hairs are shedding, or thinning of scalp, we need to consult a dermatologist. Now, Doctor, we would also like to understand that what are the medical options available for the management of hair loss?
Yeah. So coming first, when the patient comes into our clinic for the hair loss, first we need to evaluate for the cause of hair loss. So this is done usually by taking a detailed history. Okay. A detailed history of the duration of hair fall, or the number of hairs falling in a day, and the history of the diet, hormonal imbalances, or any other medications which they are taking, or any health issues or any stressful situation which had triggered off the hair fall, or and we also need to take a genetic history. At times, it could be a hereditary condition. So if some of the hair falls may be running in the family. So in such cases, a detailed history will help us to understand why exactly the hair fall is happening, and then we can treat it accordingly. And definitely, we also check into the scalp condition and the condition of the hair follicles. So this also help us to identify why the hair fall is happening. Right. And also blood investigations can be done. So if there are certain deficiencies, or some hormonal changes, we can pick these from the blood investigations. So like if there is an anemia, so there's iron deficiency, or if there's vitamin D or vitamin B12 deficiencies, and also the hypothyroidism, and various other deficiencies and hormonal imbalances, like in a condition like polycystic ovarian disease, even the insulin levels can be increased, that can contribute to hair fall, and also like the testosterone increase. All these can contribute to hair fall in an individual. So blood investigations do help us to find out the exact cause of hair fall before going into the further treatment. So now coming to the proper treatment of hair fall, if there is say, any deficiency or hormonal imbalances, we have to address that first. Apart from treating the root cause, we also give certain serums which can control hair fall. They can at least give the instant control of the hair fall within a few days once you start using them. So if it is a hair fall which is supposed to be a reversible hair fall, we do start with serums which contain some peptides and some herbal extracts which can add some nutrition to the follicles. And also we give some vitamin supplementations. So basically it contains biotin, calcium pantothenate, and also vitamin B12, vitamin D, iron, copper supplementation, selenium. All these vitamins supplementations can help in giving more nutrition to the follicles and controlling the hair fall at the earliest.
Right.
Yeah, and certain hair falls like the female pattern and the male pattern hair losses, which are progressive conditions. So these need a long-term treatment. So for these, most of the time we do recommend minoxidil solutions for these patterned hair loss, and also anti-androgens. In these kind of hair loss, androgens play a main role. So these pattern hair loss, they can be a hereditary condition where, because of the genetic tendency, genetically the follicles are sensitive to the androgens. So because of the sensitivity, the androgens basically they convert the hairs from the growth phase to the resting phase, and there will be a gradual loss of hair fall, and where patients noting thinning of the scalp. So in such cases, they may not notice an increase in the number of hair fall, but the hair which goes to the telogen phase doesn't come back to the growth phase. That's why they are losing. They are losing. Okay, in such cases, yeah, we have to give some anti-androgens like finasteride can be given to control the hair thinning and the hair loss.
Okay.
Yeah.
Yeah.
And
So,
apart from these topicals and the supplementations, we also do certain treatments for hair fall control, like those who do not respond. At times, what happens is some people they do not respond to
right.
these topical agents and these oral supplementations also. In such cases, we do something called as a platelet-rich plasma. So where we take the patient's blood, separate the growth factors, and then we inject it into the scalp where there is hair thinning, so that it stimulates the conversion of the hairs from the telogen phase to the anagen phase. So the follicles which are in the resting phase, they convert into the growth phase, and so there is some hair growth which can happen on the scalp. So
Right.
and recently, we have been using a lot of like growth factor concentrate. So this is the advanced form of PRP. In this, we use tubes in which the platelets are broken down in the tube itself, and the growth. So as we are injecting the serum containing only growth factors, so the effectiveness of the treatment is much better. And also the pain of the treatment is also very less, as it's an acellular serum. And with this treatment, we can achieve good results with less number of sessions and the minimum time.
Okay. So apart from the medical management of hair loss, we have non-surgical management of hair loss and surgical management of hair loss as well. But many a times people, or I should say patient, become very skeptical. They are not very sure that these non-surgical or surgicals are safe, or whether they can go for it or not, or how pocket friendly are these. So can you shed more light on that as well, doctor?
Yeah, sure. See, one thing is uh, these treatments are done for those who do not respond to the topical agents, what we prescribe, or the supplementations, what we give. So this is an add-on treatment along with the topicals and the supplementations, what we do. And the purpose of these treatments is to stimulate some growth. So because what happens is, if you don't treat it in the early stage, there is a tendency that we may not be able to give a response later. Okay, in spite of giving the topicals, taking supplementations, if the hair growth is not happening, and if it is left in the telogen phase for a longer duration, we may not be able to recover them later. So in considering that, maybe investing on these treatments can help in recovering some of the lost hair, and then probably it can be maintained with the topicals and the supplementations.
Right, right. And we would also like to understand, though you have already touched it, but still the role of nutraceuticals in hair loss. Nutraceuticals.
Yeah, nutraceuticals, they are basically the supplementations, and they are derived from the plant extracts. And they basically help in stimulating the hair growth. And so and so these, they basically contain certain vitamins, minerals, and also some amino acids, and also antioxidants. Okay, so the nutraceuticals basically they can biotin and vitamin B12, and all of the B complex vitamins, vitamin C, vitamin E, and also minerals like iron, calcium, copper, selenium, and certain herbal extracts, like the grapeseed extract, green tea extract, and these millet seed extracts. So these are basically the nutrients which regulate the hair cycle. Okay. So they are important, like especially when there is a obvious hair fall, taking these nutrition supplements do help in regularizing the hair cycle and bring the hair fall under control.
Right.
Also, some of them have the anti-inflammatory property, and also the antioxidant properties. So these also help in reducing the inflammation, because some of the hair falls are due to the inflammatory change which is happening in the scalp, can be responsible for hair fall. So the anti-inflammatory and antioxidant benefits of these nutraceuticals, they can help in reducing the inflammation and then controlling the hair fall. And also some of them do contain these dihydrotestosterone inhibitors.
Okay.
So in such cases, these are used in the androgenic alopecia, the male pattern and the female pattern hair losses, which can reduce where the testosterone levels are responsible for the hair fall.
Okay. Now, Doctor, nutraceuticals, as you said, can promote hair growth, or, in a way can help growing hairs. Then you also said that there are, importance of zinc, iron, biotin. There are so many things, B complex. They actually help in keeping the hair health. Now, the thing is, there are two ways to going for them. First, you go to the dermatologist. They'll suggest you that, okay, you are biotin deficient, or maybe B complex deficient. They'll prescribe you the supplements and you go and have them. But then there is also a number of people who, just because they are having hair fall, they know biotin helps, restricting hair loss, or B complex may help. They'll go get them by self from the chemist shop and start popping them in. Nowadays, a lot of gums and chews, they are also available, and the way they are promoting it is by saying that they'll control your hair loss. How safe is that, or is it okay to go for these supplements over the counter and have it?
Yeah, the over-the-counter supplements. See, first thing, without understanding the cause of hair fall, it is not right to take a supplement which is not necessary. If it is a supplement which is not needed for that individual, then it is a waste. Waste in terms of investment, and also waste in, like, for the body requirement also. So it is always better to evaluate the cause of hair fall and then go for supplementations. So I think that would be a better way of treating their hair fall, rather than just taking supplementations without knowing the exact cause why the hair fall is happening.
Right. And one more thing, which is very common in our society, is dandruff. And definitely, people, they don't know how to get it treated, what to do about it. A very normal notion is to add a lot of oil because we think that dandruff is, we are having these dandruffs because our head is or our scalp is very dry. So we end up applying a lot of oil and it keeps on worsening the situation. So, does dandruff cause hair fall or hair loss, and how to treat it?
Yeah, dandruff is actually the scaling on the scalp is called as dandruff.
Mhm.
See, at times the scaling can be because of dryness of the scalp. Like especially now we are in the winter season, the scalp tends to get
Right.
drier, and that can cause some amount of drying. And also, at times it can go to a stage where there is excessive scaling and there is a lot of itching, redness on the scalp. And we call it as a seborrheic dermatitis. So this usually happens when there is a fungus called as malassezia, which grows on the scalp. So it is normally present as a commensal on the scalp, but when it finds a condition where there is excessive oil secretion, it multiplies. And also it breaks down the oil and it releases certain irritants which can irritate the scalp, cause inflammation on the scalp, and that can cause the dandruff. And because of the inflammation, there could be some damage to the hair follicles also, which can contribute to hair fall. So dandruff to some extent adds on to the hair fall,
Mhm.
though by itself is not a root cause for hair fall. The inflammatory change which happens because of the uh, uh, certain irritants which are produced on the scalp. So
Mhm.
some amount of hair fall can be associated with dandruff.
Okay. Right. So, again, to treat it, we need to go and consult a
Yeah,
dermatologist.
so definitely yes. Evaluating the scalp does help us to understand why the hair fall is happening, and accordingly, the treatment can be done.
Okay. I'll also take some of the questions that our viewers are asking. So, Gehna Sahu is asking, does transplanted hair always fall out?
Transplantation is most of the time transplantation is done in male pattern hair loss. So it is basically done to bring the hairline down so that they have a more youthful appearance. And usually
Mhm.
the transplanted hair is taken from the occipital area, that is from the behind portion of the scalp.
Right.
So that usually these follicles they retain their uh, hair cycle. So usually,
Mhm.
as I said, each follicle has an independent hair cycle. So the hair follicle, which is on the behind portion, it is not under the influence of the androgens. So
Right.
it remains for a longer duration uh, when compared to the follicles which are there in the front
Mhm.
part of the scalp, which is under the androgen influence. So
Right.
yeah, definitely the follicles which is transplanted will definitely remain for many years.
Mhm. Okay. Now, Kirti Kapoor is asking, is keratin and smoothing, these are the treatments, many people go for. Are they good or healthy for hairs?
Keratin treatments, smoothing of the hairs. Um, yeah, they do help in supplementing the keratin to the follicles. At the same time, they also have some side effects, especially
Okay.
in keratin smoothing. A chemical called as formaldehyde is uh, used.
Okay. Right.
So this causes a lot of side effects due to inhalation of the formaldehyde. So
Mm-hmm.
otherwise, done safely once in a while, the keratin smoothing should not be a problem to the hair, but still
Mm-hmm.
some of them do experience some amount of hair fall
Okay.
after these smoothing procedures, straightening procedures. Sometimes these heat is applied to the hairs, where it
Right.
causes damage and breakage of the hair follicles. So done once in a while in a proper salon, then it should not cause much problem to the follicles.
Mm-hmm. We have another question on the similar lines by Shubham Maran. He's asking, does using a hair dryer or straightener damages hair?
Hair dryer, yes, definitely the heat of the hair dryer can, because hair is basically made up of proteins. When a protein is exposed to heat, it undergoes denaturation. So there is a breakdown of the protein there, so which is responsible for the breakage of the hair and the hair fall.
Mm-hmm.
And yeah, definitely the heat, the straighteners also, the heat is applied to the hair follicles, so which can damage the hair follicles and cause hair fall.
Okay. Keshvi Thakur is asking a very interesting question. Does onion regrows hair? Because a lot of people these days are using onion juice or onion juice infused oil. So, do they work?
See, onion is basically it works as an irritant. Okay,
Mm-hmm.
and some of the irritants do stimulate the
Hair growth.
hair growth.
Mm-hmm.
See, at times some people do apply onion paste on the scalp, and yeah, but you have to do it very safely. But because you might tend to develop something called as an allergic contact dermatitis.
Okay.
So that is one like side effect of applying the onion paste, which can help in stimulating the hair growth. So
Mm-hmm.
otherwise, so if it is not causing any problem, then it should not be a like there's no need for you to not use the onion application on the scan. But if it is
Mm-hmm.
causing a problem, then definitely it is not advisable.
Right. Okay, so again, I'm clubbing two questions. One is by Shehnaz Khan. Her question is, what are the main causes of graying of hairs at a very young age? And a related question is by Abhishek Mishra. His 16-year-old daughter is having, gray hairs, and he's seeking advice from you.
Yeah. So gray hairs nowadays we are seeing a lot of young school-going children developing gray hair.
Mm-hmm.
Okay, so one of the main reasons for this could be nutrition deficiencies, or sometimes stress also can contribute to the graying. So nutrition's so usually the hair color uh, is basically by the cell called as a melanocyte. The hair root, it contains a cell called as a melanocyte, which
Mm-hmm.
produce pigment for the hair follicle. So, and these melanocyte does need all vitamins and minerals, and to produce the adequate amount of pigment to the hair to the hair follicle.
Mm-hmm.
So when there are people, especially the youngsters who are taking a lot of junk food, okay, without vegetables, fruits in their diet, that could be contributing to the graying, which is happening at a very early age, and also stress. So I think everyone are undergoing stress, including from starting from a nursery kid, I think
Right.
to the elderly people, everyone are nowadays they are undergoing stress.
Right.
So due to various reasons. So stress is also one of the reasons where when a person is under stress, there are something called as um, uh, these uh, um, like the oxidants which
Mm-hmm.
damage these cells are released. Okay, so basically the follicles undergo an oxidative stress during stress. So in such cases also, there is damage to the cells in the hair follicle, which destroys the melanocytes, which inactivates the melanocytes and cause graying of the hair. So maybe
Okay.
some measures for stress management can help in making the condition better.
Right. So stress management plus what you are eating, how healthy is your lifestyle, these all contribute in healthy hair, or you need to check on all these points. And you definitely have the access to a qualified dermatologist. You can definitely go for that, as well as soon as you see something wrong going on with your hair, your scalp, your skin. Now, Aditi Srivastav is here, doctor, asking, Doctor, I'm suffering from hair scalp itching and boils since last 3 years. I have done a lot of treatments, but still no result. She's still suffering from these itchiness and boils.
Okay. So itching and boils on the scalp indicates that she might be having seborrheic dermatitis. So it is a severe form of the dandruff where there is a lot of inflammation on the scalp. So that is the main reason for itching on the scalp, and there is growth of the Malassezia fungus on the scalp, which also can be contributing to the itching. And also, like when there is damage to the scalp, easily a bacteria can enter into a damaged scalp. So that can be a reason for the folliculitis which is happening. So where they develop the painful boils around the hair follicles. So for this, first definitely if there are boils, it has to be treated with the antibiotics so that those the painful boils are brought under control. And also anti-inflammatory lotions can be given to reduce the inflammation and the damage to the scalp. And also the anti-dandruff shampoos containing antifungal agents like ketoconazole, cycloparaxolamine. So these can be used to control the dandruff, but definitely it has to be done under a dermatologist's consultation. So please do
Right.
not self-medicate. Take a dermatologist's opinion and then use these products. And in very severe cases which do not respond to any of these, some anti-systemic antifungal agents can be prescribed. So the oral
Okay.
antifungals also can help in unresponsive cases.
Right, right. And we have Yati Gohar asking how many times a week should one wash their hairs? And I would like to add to that, doctor, because many a times people are so scared of washing their hair and conditioning their hair because, at time of washing and conditioning, we again see a lot of hairs coming out from our scalp. So many of us has this notion that maybe it's because we are, washing our hair or conditioning that's making our hairs fall. What's the right thing to do?
Yeah. So washing the hair depends on the kind of scalp and the kind of hairs that they have. If your hair is dry, washing once or twice in a week is sufficient. But if your hair is oily, if the scalp is oily, everyday washing is better. And also, if you are exposed to the pollution, if you are moving outside every day, and if you're exposed to the pollutants, washing the hair every day is definitely recommended. And if you are gymming every day or sweating every day washing is very much important. And the hair fall while washing, uh, see, hair wash causing a hair fall is a myth. So hair wash by
Okay.
itself is not will not cause a hair fall. So
Mhm.
usually when you wash the hairs which are in the resting phase, the telogen phase, which are supposed to fall by itself, they come out at the same time. So that's why you feel that the hair losses more when you wash the hair. But it is not actually the hair wash which is causing hair fall, but it is the hair which are supposed to fall are falling at the same time. So that's why you see that increase in the hair fall when you wash. So when you wash every day, in fact, you see the number of hairs falling is less. than
Right.
if you wash like once a week or once in 10 days.
Right, right. So keeping your scalp clean is actually what you need to do. Ramachandra B is asking, my side hair, I'm losing my side hairs, and now a lot of thinning is happening. Any remedies?
Yeah, a lot of thinning of the hair. Then we need to think of the androgenic alopecia,
Mm-hmm.
okay, or the male pattern baldness.
Right. Mm.
So this can be a hereditary issue, or at times it can be triggered by stress also. So, as I said, genetically, the follicles in the front portion of the vertex and the hairline, they
Mhm.
can be sensitive to the hormone testosterone. So, which converts the hair from the growth phase to the resting phase, and then there is a hair fall. And during stress, also there is excessive androgen secretion.
Mhm.
So these, when the androgen secretion increases also, these androgen sensitive follicles, they undergo conversion to the resting phase and there is a hair fall. And usually when, as I said, what they notice is a receding of the hairline and thinning the vertex area. So, yeah, so this is about the androgenic alopecia which is happening, and this, yeah, it can be treated basically with minoxidil solution and anti-androgens like finasteride. So
Mhm.
they can help in controlling the hair fall, and this kind of a hair fall is a progressive condition. So the
Mhm.
treatment for this hair fall, it will go for many years. So it's a long-term treatment. So taking a long-term treatment will help in delaying further progression and maintaining the hairs for many more years.
Right. So you need to go and consult a doctor, a dermatologist in this case, and yeah, start the treatment as soon as possible so that you can see some relief or betterment in your condition. Now, the thing is, doctor, I'm sure you'll also agree with me in that nowadays, because of so many social media influencers are there, markets are flooded with products. We have like 50 products for hair care, but still we end up losing or shedding a lot of hair, and we are really confused how to take good care of our hairs. So important tips for healthy hair.
Yeah, healthy hair. Definitely, healthy hair needs a healthy diet. So our diet is very much important for hair health.
Mm.
So we should take, and our hair is basically made up of proteins.
Right.
So diet rich in proteins is very much important to have a good healthy hair. And apart from proteins, a wholesome diet is needed. A healthy balanced diet with whole grains and lots of vegetables and fruits, which can be supplementations of all vitamins and minerals and antioxidants. And you can take a lot of nuts, which can be a rich source of proteins, calcium, iron, and essential fatty acids, which are needed to regulate our hair cycle and the hair growth. And also dates, which is rich in iron, can also help in like reducing the hair fall and keeping our hair in a good, healthy condition. And apart from diet, our healthy lifestyle is also very much important. As I already mentioned, stress is nowadays one of the commonest cause for hair fall.
Mm.
So stress, uh, so that's the our healthy lifestyle helps in keeping the stress at bay. So doing exercises regularly, yoga, breathing exercises. So all these help to regularize our body conditions. So and also exercises, they increase the blood supply to all parts of the body and also onto the scalp. So it helps in giving more nutrition to the scalp and controlling the hair fall. And coming and also good sleep is needed. So having a
Mhm.
good sleep, it helps in relaxing our body and reducing the stress. And also, if someone is smoking, it's better to avoid, as the smoking, it constricts the blood vessels, and it reduces the supply of oxygen and nutrition to the hair follicles, and that can precipitate a hair fall. So overall, a healthy lifestyle is very much essential to have a good control on the hair fall and to keep your hair in a good healthy condition. And next, coming to the hair care routine. So for a healthy hair, we also need a healthy hair care routine.
Right.
So starting from the hair wash. So maybe if your scalp is a little dry, you can just gently massage some warm oil on the scalp. So you can use a coconut oil, which also has an anti-inflammatory properties on the scalp. I can use almond oil or olive oil or castor oil. You can just warm a little bit and gently apply, gently massage the scalp so that the circulation to the scalp also increases, and you can wash it off with in 1 or 2 hours. So, but when applying oil, you have to be a little cautious. Don't apply too much oil and leave it for many days without washing, because this can attract the fungal growth on the scalp, and the dandruff and seborrheic dermatitis can increase with excessive oiling also. So, oiling to some extent in a limited way does help in nourishing the hair follicles and keeping it in a good health. And while washing the hair, don't use very hot water. So especially in winter season, there's a tendency that people want to use very hot water. So try to avoid using hot water, because this can remove the natural oils from the skin. So use a lukewarm water. So that will retain the natural oils which are present on our scalp. Then also you can use while washing the hair, you can use sulfate-free shampoos, so which do not dry your hair, so which are protective on your hair. And also, like after shampooing, you can use a conditioner. You can use a good conditioner, thick, creamy conditioner, which can retain the strength of the hair follicles. So the conditioner is generally a moisturizer for the hair follicle, just like we apply moisturizer for our skin. After taking bath, you apply conditioner to the hair to moisturize the hair follicles, and the conditioners are usually should be applied only on the hair length, and avoid applying a conditioner on the hair scalp, because it can damage the hair scalp, and it can also stimulate the fungal growth on the scalp, and it can cause dandruff. So try to avoid applying conditioner on the scalp. Apply it only on the hair length. So you can leave the hair about 1 or 2 inches from the scalp and apply the conditioner the whole length till the tip of the follicles. And after hair wash, so what you need to do is like drying. Okay, don't leave it wet for a longer duration. Dry it immediately. You can either just towel dry it gently, but don't rub it harshly with the towel, so that the follicles just get plugged off. And or you can air dry under a fan, or you can also use a blow dryer at a very low temperature. Okay, don't use it at a higher temperature, because again there is going to be damage to the hair fall because of heat, and there can be breakage of the follicles. So drying immediately after washing is very much important, and do not comb on a wet hair. Okay, allow it to dry. Okay, when it is around 80-90% dry, then you can start combing in. You can use a wide tooth comb or a hair brush, so that the tangles are removed.
You can detangle them, right?
Yeah.
Okay.
So, and the hair doesn't get damaged during the process of combing. So, and yeah, apart from this, like I mean, many hair styling procedures are done nowadays. People want to straighten and they want to color their hairs. So, in
Yes.
such cases, try to avoid these procedures as much as possible. So,
All
keep it to the
right.
minimum so that the damage done to our follicles will be very minimum.
Yes, yes. Yeah, and I'm sure practicing all these tips, we can actually maintain healthy hair.
Yeah.
It was wonder talking to you, Doctor. Thank you so very much, Dr. Sujay M, for your valuable guidance and advice on how to keep our hair healthy. And I'm sure your guidance will help our viewers and viewers who want to get personal consultation from Dr. Sujay M. You can get it at Medicare Skin and Cosmetic Clinic, Bangalore. A big thank you to all our viewers as well for watching the show. And for more information on how to get all your hair issues resolved, do like and subscribe to our YouTube channel, Hair All Issues Resolved. Thank you.
Yeah, thank
Goodbye.
you. Thank you to all the viewers and thank you, Samyukta, for the wonderful anchoring. And
Thank you, Doctor.
yeah, thank
It
you.
was a
Thank you.
pleasure having you. We had a very informative session. Thank you so very much once again. Thank you, everyone. Goodbye. Good day.